I'm your host, EV. Today, we delve into the artificial intelligence that has emerged as a transformative force in healthcare, offering unprecedented opportunities to enhance patient outcomes and revolutionize medical practices. AI technologies, with their ability to process vast amounts of data, recognize patterns, and generate predictive insights, are proving invaluable across various domains of healthcare, from diagnostics to treatment planning and beyond. These systems can swiftly analyze medical imagery, predict disease progression, personalize patient treatment plans, and optimize healthcare operations, leading to more accurate diagnoses, more effective therapies, and increased operational efficiencies. In essence, AI has the potential to foster a proactive, precision-focused healthcare landscape, empowering medical professionals to deliver care that is not only more efficient but also more personalized and patient-centered. A groundbreaking example of AI's transformative potential can be seen in the NHS's recently launched trial to enhance breast cancer diagnosis and treatment. This world-leading trial, involving nearly 700,000 women across England, is set to explore the application of cutting-edge AI tools in early breast cancer detection. Supported by the UK government and integrated into routine NHS screenings, this initiative aims to deploy sophisticated AI algorithms that assist radiologists in identifying subtle changes in breast tissue indicative of cancer. Through this trial, the NHS seeks to evaluate not only the accuracy and efficiency improvements in cancer detection, but also the broader implications for healthcare resource allocation and patient care pathways. By harnessing AI, the NHS anticipates transforming cancer care, reducing diagnostic waiting times, and improving survival rates. This trial marks a significant step in not only addressing one of the most common cancers among women, but also in setting a precedent for future AI innovations across the healthcare system. As the trial unfolds, the outcomes are expected to offer valuable insights into the integration of AI into medical diagnostics, shaping the future of modern healthcare. Breast cancer remains the most prevalent cancer affecting women worldwide, with early detection being crucial for effective treatment and improved survival rates. Despite advances in screening technologies, significant challenges in early and accurate diagnosis persist, often due to the human limitations of existing diagnostic processes. In response, the NHS has embarked on a pioneering initiative known as the EDITH trial, early detection using information technology in health, set to involve nearly 700,000 women across England. This ambitious project aims to evaluate the integration of artificial intelligence, AI, tools into the breast cancer screening process, with the overarching objective of improving early detection rates and optimizing the efficiency of healthcare delivery. By supplementing the expertise of radiologists with advanced AI algorithms, the NHS seeks to enhance diagnostic accuracy, reduce false positive and negative rates, and ultimately improve patient outcomes. At the heart of the EDITH trial are sophisticated AI technologies designed to analyze mammographic images with enhanced precision. The trial employs cutting-edge machine learning algorithms trained on large datasets to detect subtle changes in breast tissue that may indicate the presence of cancer, often escaping traditional analysis. This involves the use of AI-powered image recognition tools capable of identifying patterns and anomalies that might be overlooked by the human eye, particularly in complex or ambiguous cases. As part of the trial, 30 testing sites across the country have been selected and equipped with these digital AI technologies. Women who are scheduled for routine NHS breast cancer screenings are invited to participate, where their mammograms are reviewed by AI systems in tandem with radiologists. The technology is intended to work as an assistive tool, allowing a single radiologist, rather than the typical two, to perform mammogram readings without compromising safety or accuracy. The integration of AI into breast cancer screening holds the promise of transformative implications for early detection and treatment efficiencies. Should the trial prove successful, it could lead to a paradigm shift in how healthcare providers approach cancer screening and diagnosis. One significant benefit is the potential to free up radiologists' time, enabling them to focus on more complex cases and manage higher patient volumes. Such efficiencies align with broader healthcare system goals of reducing waiting times for diagnostic results and delivering timely interventions, which are critical for patient prognosis and survival rates. Furthermore, AI's capacity to provide consistent and objective analyses could lead to improved accuracy in detecting early-stage cancers, decreasing both false negatives and unnecessary follow-up procedures prompted by false positives. This can potentially enhance patient experiences by alleviating anxiety associated with ambiguous screening results and reducing unnecessary exposure to additional diagnostic procedures. From a healthcare system's perspective, the cost savings associated with streamlined processes and improved resource allocation could be significant. Reducing the need for redundant tests and optimizing radiology workflows contribute to a more sustainable healthcare model that can better cope with increasing demand and resource pressures. Overall, the NHS breast cancer AI trial embodies a forward-thinking approach to harnessing technology for public health benefit, setting the stage for greater integration of AI technologies in future medical diagnostics and treatments. With committed support from the UK government and healthcare authorities, this trial represents a crucial step towards realizing the full potential of AI in transforming cancer care and addressing one of the nation's most pressing health challenges. The integration of artificial intelligence, AI, in medical diagnostics has become a prominent area of research and development, with numerous studies exploring its potential to enhance clinical practice. A significant study published in JAMA Network Open involved researchers from the University of Minnesota Medical School, Stanford University, and others, examining the role of GPT-4, a large language model, as a diagnostic aid. The study observed 50 US licensed physicians across various specialties using GPT-4 for diagnostic tasks. Findings indicated that GPT-4 performed remarkably well in generating diagnostic suggestions independently, achieving a diagnostic performance that surpassed traditional methods used by clinicians. Notably, while the AI model demonstrated significant competence in identifying disease patterns, it did not substantially enhance the performance of physicians when used as a supplementary tool, highlighting the complexity of synergizing AI with human expertise. Another study focused on the application of AI in radiology, particularly in identifying malignancies in medical imaging. AI systems, trained on massive datasets of radiological images, have shown the capability to detect abnormalities with comparable, sometimes superior, accuracy to radiologists. For instance, AI algorithms have been developed to recognize breast cancer in mammograms, achieving sensitivity rates akin to, if not better than, those of experienced human radiologists. These advancements underscore AI's potential to function as a critical diagnostic tool, particularly in specialties reliant on imaging and pattern recognition. AI's capability to process and analyze extensive datasets offers a distinct advantage over human clinicians, who may be limited by factors such as fatigue and cognitive biases. In specific diagnostic tasks, AI models have outperformed human counterparts, particularly in pattern recognition within complex datasets, such as imaging. For instance, AI algorithms designed for image analysis have exhibited high accuracy in diagnosing conditions like diabetic retinopathy, lung cancer in CT scans, and skin cancer from dermatoscopic images. The precision with which AI can standardize assessments and reduce inconsistencies offers substantial promise in increasing diagnostic reliability. However, AI's current limitations must be acknowledged. While AI can identify correlations and patterns in data, it lacks the intuitive and experiential insight that human clinicians bring to the diagnostic process. Human clinicians excel in areas requiring holistic evaluation, contextual judgment, and patient interaction, elements currently outside the full reach of AI technologies. Moreover, these technologies can struggle with atypical presentations or rare diseases absent in training datasets, underscoring the necessity for human oversight and judgment. The complementary strengths of AI and human intelligence suggest a collaborative future in diagnostics, where AI enhances rather than replaces clinician capacities. The ideal model would leverage AI's data processing prowess with human insight, ensuring comprehensive, accurate, and empathetic patient care. While the integration of AI in diagnostics holds remarkable potential, it also presents ethical and practical challenges that require careful consideration. The primary ethical concern is patient privacy. AI systems rely heavily on vast datasets, raising questions about data security and the potential for breaches. Ensuring strict compliance with regulations like GDPR and HIPAA is critical to protect patient information and maintain trust in digital health innovations. AI also poses the risk of algorithmic bias. Patterns discerned by AI models are dependent on the data they are trained on. If these datasets reflect historical biases, AI systems can perpetuate or even exacerbate existing inequalities in healthcare outcomes. For example, diagnostic algorithms trained on predominantly male skin images might fail to accurately diagnose conditions in female patients. Awareness and active mitigation of such biases are essential to prevent AI from widening existing health disparities. From a practical perspective, integrating AI into clinical settings necessitates significant adjustments in workflows and training. Healthcare professionals must be equipped with the knowledge and skills to effectively interpret AI outputs and make informed decisions. This requires the development of educational programs that emphasize digital literacy, critical thinking, and collaboration between AI and human clinicians. Moreover, there is a need for robust validation studies to ensure AI systems are reliable and fit for clinical practice, including standardized protocols for evaluating AI tools before widespread implementation. Another challenge is the black box nature of many AI models, particularly those based on deep learning. These models can offer predictions without clear explanations, complicating clinicians' ability to trust and act on AI-generated insights. Transparency and explainability in AI systems are crucial, as they directly impact clinician reliance and patient safety. Despite these challenges, the benefits of AI in diagnostics can be significant if these issues are addressed. By facilitating earlier and more accurate diagnoses, AI has the potential to transform healthcare delivery, optimize resource utilization, and ultimately improve patient outcomes. Emphasizing ethical standards, continual education, and collaborative model development will be key in realizing AI's potential within medical diagnostics while safeguarding patient well-being and clinician autonomy. The integration of AI in medical diagnostics presents a frontier ripe with opportunity yet fraught with challenges. By prioritizing ethical integrity, fostering clinician readiness, and committing to equitable health outcomes, AI can emerge as a pivotal partner in the evolving landscape of healthcare, enhancing the diagnostic capabilities of clinicians and improving the quality of patient care globally. As technology progresses, a balanced approach that values both innovation and human oversight will be crucial in navigating this transformative era in medicine. The history of diagnostic technology is a testament to medicine's continuous pursuit of accuracy and patient care improvement. This evolution began in the early 19th century with the invention of the stethoscope by René Laennec in 1816. The stethoscope revolutionized clinical practice, allowing physicians to listen to the internal sounds of the body non-invasively, which was a significant leap forward from relying solely on external symptoms and patient descriptions. Its introduction marked the advent of more direct and reliable diagnostic methods, contributing to a better understanding of diseases involving the heart and lungs. Following this, the 20th century saw the advent of X-ray technology by Wilhelm Conrad Röntgen in 1895, fundamentally changing how diseases were diagnosed. X-rays provided a method to visualize internal structures, aiding in the detection of fractures, tumors, and other internal anomalies without surgical intervention. This period also brought forth numerous other imaging technologies such as ultrasound, CT scans, and MRI, each contributing to progressively more detailed insights into the human body. In the late 20th and early 21st centuries, the digital revolution and advances in computing power paved the way for the integration of artificial intelligence, AI, in diagnostics. AI technologies have expanded the capabilities of diagnostic tools exponentially by enabling the analysis of massive datasets and complex imaging with unparalleled precision and speed. AI-driven diagnostics now promise to enhance early disease detection and tailor personalized treatment plans, embodying the culmination of centuries of technological advancement. Each leap forward in diagnostic technology has historically been met with a blend of skepticism and enthusiasm. The introduction of the stethoscope, for instance, encountered resistance from some physicians who viewed it as an impersonal tool that could disrupt the doctor-patient relationship. Over time, its proven efficacy led to widespread acceptance, transforming it into an indispensable icon of medical practice. Similarly, X-ray technology initially faced skepticism not only due to concerns about safety and radiation exposure, but also due to the unprecedented nature of visualizing internal anatomy. As these concerns were addressed and the diagnostic value became undeniable, X-rays too became a cornerstone of modern diagnostics, illustrating medicine's ability to adapt and integrate new tools effectively. The current era of AI in diagnostics is no different. While AI holds vast potential, it has also attractive concerns regarding its impact on clinical roles and the dehumanization of patient care. Additionally, issues of transparency in AI decision-making processes and potential biases loom large. Nonetheless, as with previous technological advances, the medical community is gradually adapting to incorporate AI-driven tools, balancing caution with the burgeoning benefits they offer. The historical trajectory from the stethoscope to AI demonstrates a consistent pattern. Initial skepticism giving way to enthusiastic integration as technologies prove their worth in enhancing diagnostic accuracy and patient outcomes. Each innovation has built upon its predecessors, enabling more precise, non-invasive, and comprehensive diagnostic capabilities. As AI technologies continue to develop, the medical community is learning to address the ethical and practical challenges they present, illustrating an enduring capacity to adapt and improve the art and science of diagnostics. The evolution of diagnostic technologies is a narrative of medicine's commitment to embracing innovation, learning from past experiences, and meticulously integrating new tools to ultimately serve the fundamental goal of improving patient care. As AI becomes increasingly embedded in medical practice, it continues this legacy, promising transformative advances in diagnostic accuracy and healthcare delivery while underscoring the necessity for ongoing adaptation and a human-centric approach. Artificial intelligence, AI, holds significant promise for revolutionizing healthcare, including addressing long-standing diagnostic disparities. By leveraging vast datasets, AI can enhance diagnostic precision, making high-quality healthcare more accessible. In remote areas with limited medical expertise, AI tools can serve as diagnostic aids, offering insights that might otherwise be unavailable. For instance, AI-powered imaging analysis can help community health workers in rural settings detect conditions like tuberculosis or diabetic retinopathy, bridging gaps in specialist availability. AI's ability to process diverse data sources also allows for personalized diagnostics, potentially mitigating disparities related to age, gender, or ethnicity by offering tailored assessments. Tools like natural language processing, when trained on a wide range of languages and dialects, can improve service delivery to non-English speaking populations, enhancing their access to accurate diagnoses. However, AI's potential to exacerbate existing health disparities is a real concern. If AI models are trained on biased datasets that lack diversity, they can perpetuate systemic inequalities. For example, an AI system trained primarily on images from one demographic group may not accurately diagnose conditions in other groups, leading to misdiagnoses or overlooked conditions. Moreover, AI systems might not consider socioeconomic and cultural factors crucial to accurate diagnosis, thus failing to address the social determinants of health that contribute to disparities. To ensure AI contributes positively to healthcare equity, it is crucial to train models on diverse and representative datasets and to incorporate continuous monitoring for biases. It's also essential to develop AI solutions in collaboration with underserved communities to ensure they meet the unique needs of these populations. Several case studies exemplify both the opportunities and challenges AI presents in addressing healthcare disparities across diverse populations. One notable example is an AI model developed to screen diabetic retinopathy in India, where a significant portion of the population lacks access to retinal specialists. This AI tool was trained to function effectively even in the varying socio-economic and geographical conditions found across India. By deploying these AI-driven screenings in rural clinics, healthcare providers have managed to facilitate early diagnosis and intervention, reducing blindness rates among underserved populations. In contrast, a study published in 2019 revealed that an AI system developed for predicting the risk of health conditions like cardiovascular disease had inaccuracies when applied to African American patients. The algorithm's predictive accuracy decreased for this demographic because the training data had underrepresented these patients, illustrating how biased input data can lead to health disparities. To tackle such issues, some organizations are working on inclusive AI initiatives. For instance, the NIH has funded projects to ensure that algorithms are developed using data from diverse racial and ethnic groups, focusing on diseases that disproportionately affect minority populations. Additionally, AI-driven chatbots have shown promise in expanding mental health service accessibility for Indigenous communities in Australia. These tools are designed to respect cultural sensitivities and provide mental health support in native languages, proving effective in communities with limited access to mental health professionals. In conclusion, AI's role in addressing diagnostic disparities hinges on its ability to balance cutting-edge technology with equitable practices. By ensuring that AI systems are developed transparently, inclusively, and with a commitment to addressing the unique needs of diverse patient populations, healthcare providers can leverage AI to bridge diagnostic gaps. Continuing this collaborative and reflective approach is key to ensuring AI becomes a powerful tool for achieving health equity worldwide. The integration of artificial intelligence, AI, in healthcare marks a profound opportunity to enhance, rather than replace, clinical judgment. AI's strength lies in its ability to process and analyze vast quantities of data rapidly, identifying patterns and insights that might be challenging for humans to discern. This capability enables AI to assist physicians by providing differential diagnoses, identifying potential treatment plans, and flagging unusual findings in medical imaging. Importantly, AI serves as a supplemental tool that augments the clinician's expertise, allowing for more precise diagnostics and personalized patient care. By providing evidence-based recommendations and uncovering subtle patterns, AI empowers clinicians to make more informed decisions while sparing them from the cognitive overload often associated with complex cases. As such, AI can significantly enhance diagnostic accuracy, reduce errors, and improve patient outcomes, reinforcing the doctor's role as a comprehensive caretaker who interprets AI-generated insights through the lens of experience and intuition. To realize the full potential of AI-physician collaboration, educational reforms are necessary to incorporate AI training across medical curricula. Future healthcare professionals must be equipped with the skills needed to interpret AI outputs effectively, distinguish when to trust AI-generated insights, and understand their limitations. Core competencies should include data literacy, ethical considerations specific to AI, and an understanding of AI's role in clinical workflows. Medical education should emphasize interdisciplinary collaboration, encouraging trainees to engage with data scientists and AI developers to ensure that emerging technologies align seamlessly with clinical needs. Furthermore, courses should include case studies demonstrating successful integration of AI in clinical practice, offering trainees real-world context for AI application. By doing so, we can ensure that future physicians are comfortable collaborating with AI, understanding its nuances, and utilizing it to enhance patient care while maintaining the essential human touch. The future of AI in diagnostics envisions a harmonious collaboration between technology and clinicians, where AI serves as an invaluable partner in the patient care journey. This collaboration should prioritize narrative and context, recognizing that optimal patient care extends beyond data-driven insights. AI-driven tools should integrate seamlessly into clinical environments, capturing nuanced patient histories and providing context-aware recommendations that respect cultural, social, and individual factors. Such a vision underscores the need for AI systems that are transparent, explainable, and capable of integrating into the narrative flow of patient encounters. The emphasis should be on developing AI technologies that support clinicians in synthesizing complex information, offering holistic insights while empowering doctors to tailor care through their unique understanding of the patient's narrative. Artificial intelligence is poised to revolutionize healthcare by facilitating earlier diagnoses and more precise treatments. Its capacity to efficiently process vast amounts of information offers transformative potential for enhancing patient outcomes, optimizing resource allocation, and accelerating medical advancements. However, the integration of AI in healthcare must remain human-centric. AI technologies should enhance the clinician-patient interaction, preserving empathy and understanding as foundational elements of patient care. Ensuring that AI systems are developed with ethical considerations at their core is crucial. Ultimately, the future of AI in healthcare hinges on striking a delicate balance between innovation and ethics. By fostering a collaborative environment where AI acts as a supportive tool for clinicians, we can navigate the transformative era responsibly and equitably, ensuring that technology serves humanity's greatest interests in promoting health and well-being. If you enjoyed today's discussion and found it valuable, please subscribe to the podcast, leave a review, and share it with your community. Until next time, stay curious and keep innovating. I'm EV, and this is I Forever, Establishing Smart Living.